I was having all kinds of health issues. My hands first, they swelled and started to get stiff. And I remember our family went on a vacation, and when we came back, I got a flu. And then I had some swelling and jaw pain, and my husband kept saying to me, you know, well, the swelling is menopause and the shortness of breath is because you had a flu. And we went to so many doctors, hand specialists, dermatologists, and ultimately it was sitting at my kitchen table speaking to a friend who's a rheumatologist who looked at my hands and said that I needed to go see a specialist, Fredrick Wigley, at Hopkins in the Scleroderma Center.
Well, scleroderma stands for hard skin, and it is a disease that falls into the family of autoimmune diseases. There are many autoimmune diseases that are different than scleroderma. Scleroderma is unique in that it causes hardening of the skin. The hardening of the skin comes about because of extra matrix that's made during the inflammatory phase, and the matrix, of course, is collagen that is excess in the skin. Unfortunately, the disease can be systemic and involve the heart, lung, gastrointestinal tract, or kidney, and in some cases be quite disabling.
I really got the diagnosis in a lung function test by a technician. We didn't think any big deal. I was just going to go have this test, and when I left, I was sobbing because he's the one who said, yeah, I see this all the time in scleroderma patients.
The diagnosis of scleroderma is a clinical one. It's what the patient experiences and what the doctor sees. What's unique about scleroderma are two features. One is that the patients are cold sensitive, and they have this event that we call Raynaud's phenomena. And this is where the fingers, on cold exposure, will turn white, blue, and then when they recover with warming, turn red. The second clue is the skin changes. Scleroderma means hard skin, and so the texture of the skin changes as the collagen and inflammation of the skin is irritated, and you can feel that on physical examination. So the finding of the skin, the presence of Raynaud's, and then there are some confirmatory blood tests that are seen in these patients as well.
Treatment includes immune suppressing drugs, and that treatment can make you very sick, and I got very sick. Sometimes the treatment is worse than the illness, they say, and in this case, I got very sick from the drugs, and my hair was falling out, and my lung capacity went down to 60% about, and became very anemic.
It's a family of disorders, and there's different expressions of the disease, so each patient is a little bit different. It's important to understand that it can be very mild, very hard to diagnose. In other patients, it can be quite devastating and life-threatening. That spectrum of the disease needs to be appreciated because the difference in managing patients can be very personalized. And as we move into the future, the new treatment for scleroderma is going to be very customized to the individual and the problems that they're having with the medications that are best for them.
Something that Dr. Wigley said to me, I'll never forget, when he diagnosed me, was that I have scleroderma and I drive the car and it sits in the back seat. And I have been driving the car with it in the back seat since my diagnosis.